when you realize how influential your nervous system is over every function in your body, how it affects brain function, how it affects gut function, how it affects mood, energy, concentration. I mean, pain relief is amazing, and I've been in excruciating pain, and all you want is to get out of it.
Hey, Dr. Chris Goebbels here with the Health Heroes podcast. And today is great because I have a long-term friend, Marco, and here with Shift Chiropractic. I think I met you, you're one of the first doctors I met just through some of the different consultants you worked in the past, but you've been in practice for 20
years, yeah,
20
coming
years.
up on 20, yep.
Goes by fast, doesn't it?
It's crazy.
So first of all, I love your vibe down here in Denver. I love the feel of your office when it comes in, so it's super cool. But you know, how did you get into chiropractic? Like, how did your path as a healer develop?
Oh man. First of all, thanks for having me and doing this. This is great, getting chiropractic out there and introducing us to more people throughout the city. So thanks for doing this.
All three of our viewers love to watch this.
Yeah, that's right. We're gonna pump that up for you. Yeah. I'd say the first thing, you know, I feel like a lot of it comes from what you feel like you were missing growing up, right? Like your void becomes your values, like that whole concept. So I always had this view of myself as an unhealthy person. I was constantly sick, constantly had issues. That extended all the way up and through college, and you miss things and you miss out on things or you don't take advantage of things. So then I started to see family members that were passing away with seemingly like, well, that doesn't seem like something, like that could have been prevented.
Yeah.
You know, so you get all these inputs, right? And then you go, okay, I'm really interested in health. I've always been an athlete and wanted to do something human helping. And so, you know, on the kind of cerebral side of things, at my senior year in undergrad, I did an internship at a chiropractic office and I did like an outpatient cardiac rehab because I was like, what two-way extremes, like what path am I going to take? Cardiac rehab was awesome. It was fascinating. It was really cool. But I went to the chiropractic office and it was like, you were helping people with all this stuff? Like people were coming in with like asthma, allergies, you know, obviously disc issues, neck issues, digestive disorders, and these guys were on fire. They were super pumped about it. And I was like, this is cool. This is really cool.
Yeah, it's interesting when you just watch the different things. And in my experience, when you go into any kind of medical environment, a lot of people are there because they have to be.
Right.
It's almost like a drudgery making it through the day.
Yeah.
And you go into a chiropractic office, most of the time, one that's doing well, people are like having fun.
Yep.
And they're excited. And they're just like, they generally love what they're doing.
Yeah. And what was interesting is that the cardiac rehab, these were an older population who was post-surgery or had a transplant or had, what's it called when they do the...
Like a bypass.
Yeah, thank you. Like a bypass. So these older folks were kind of on the other side of not being healthy and having to do this dramatic change and dramatic surgery to get healthy, versus the chiropractic office was like you were meeting people way before, teaching them how to be healthy, what
ideally,
to do. Ideally. So that part was attracting me too. So graduated, I worked at a software company for 3 years, and I was really intimidated about going to chiropractic school for whatever reason.
So what was your undergrad? Like, what was your background that you did software?
That was just a job I got. So it was like undergrad was basically sports physiology.
Okay.
Was what you would call it. And then I worked at this company. 9/11 happens. I have a friend and colleague on Flight 11 out of Boston. And it was one of those things where, like it did to so many people, it was just created a shift. Like, and for me, for whatever reason, it was like, okay, now's the time. So 2 weeks later, I was hauling my car down to Atlanta to go to school.
Cool.
So that was the kind of the jump that got me out of that fear. And when you get to school, it was just more than I imagined. Like just everything they were speaking about and to was just resonated with me incredibly. And then I was like, okay, I'm in the right place. I'm doing the right thing.
Awesome.
Yeah.
And did you go from school to opening your own practice right away, or did you have any steps between?
I did. I was a independent contractor at one of my mentors' office, so in Atlanta. Did that for about 18 months, and then moved out to Denver and started.
That's kind of a good time frame because you kind of figure out what you want to do and not want to do versus if you just go right away, you may have no idea. You're just like trying to survive, basically.
Yeah, exactly. And I did. I had no idea. But we were so like, you know, when you get out of school, you're so...
Yeah, I just moved here. I remember coming into Fort Collins and I had no clue. Just started.
Nothing. I knew nothing. It was like, I remember like a first like street fair I did, I literally had like a whiteboard and I taped zone pamphlets to it, and I was like, here you go, and I would just check people's zones, and it was like so scrappy, and but you got to start somewhere.
So tell me about the zone, because I know you and I know some other people I know that are chiropractors that I respect do what's considered like the zone technique. Chiropractic is that the right word?
Yeah.
So explain what this is and how it's similar or different than maybe just people just think of traditional chiropractic.
Yeah. So I got introduced to it very early at school. They don't teach it at school, so we were on the weekends doing extra seminars and learning all about it.
That's how you know there's something good. They don't teach it at school.
That's right. Yeah, common denominator at school. So what it's based on is basically there's 6 brain centers that correlate and control 6 systems of the body. So you've got a glandular zone, which is all the glands of the body. You've got an eliminative system, which is everything to do with getting stuff out, right? Like lungs,
Like
kidneys,
lymphatics
bowels.
and all that stuff.
Nerve zone, which deals with all the peripheral nerves, but also your fight or flight mechanisms. Zone 4 is digestive zone, so all digestive function. 5 is muscular, and then 6 is circulatory. So what we can do is we can analyze and figure out which one of those zones is not firing appropriately. So what part of your brain is not speaking to that system of the body. And there's very specific cord levels that we stimulate. So it's technically what you call like a cord stimulation technique. So,
which makes sense because the brain and nervous system is a sensory input system.
That's it. Yeah, that's exactly it. I was just going to say, the brain can only respond to the input that it gets. So if you give it proper input, then it knows what to do, and you're going to get better messages back down into the body.
Yeah, it's kind of like garbage in, garbage
out.
That's
it. Yep, exactly. So once we do that, the body starts to heal because now we've got good communication. The brain is communicating properly with that system of the body. It's really, really hard to get over things if your brain and your muscles aren't communicating, if your brain and your liver are not communicating. So that's how I think it's much different than what people commonly think of as chiropractic. And it really opens a door for folks too when I can check their zones and they go, oh yeah, I've got allergies and asthma, or I'll ask them like, how long have you had digestive issues, just by checking the base of their skull.
People are blown away, like, how did you know I had digestive issues?
Yeah, exactly, right? Yeah. Or circulatory issues or whatever. So then that opens the door to say, hey, we can really get more done here and get things, better.
Excellent. And I think you have a similar philosophy that chiropractic's really about just getting your body to function as well as it can.
Right.
But you can't. I think it's really hard, if not impossible, to live an optimally healthy lifestyle without chiropractic care, especially in an environment where we're chronically sedentary.
Yep.
But I don't think you can only do chiropractic. There's other things. And that's what I love about what you guys do, because you guys do some other things regarding health too.
Yeah.
And I know just through years of experience and advanced trainings, you've developed a bit of your own like healing method or framework.
Right.
So can you talk a little bit about like just your healing system that you've developed?
Yeah. It's always an evolution. As you know, we're always learning and growing. There's always new technologies coming out. But I think the fundamentals of healing always stay the same. And we just learn new ways to tap into that. So when I first opened, like we talked about, like not knowing anything, just trying to get it going, it was just chiropractic care all the time, and that's all we did, and we got great results with that.
And I think that's maybe a good way to start, because you have to master something before you can add additional things.
Exactly. And when you come out too, you're so focused on that. You're so focused on like, this is what I'm trained to do, this is what I know how to do. And so you come from that lens with whatever you do. That would be with any kind of practitioner. But then as you go along, you realize, oh, this 10% here, this 5% here, not getting better. Or what am I missing? Or what's the issue? Or people come in and you're like, how do I work on that? So that brings you to the next question, or brings you to the next exploration of how can I help these people. So then you tie that with your own healing journey, right? Taking care of yourself, and you come up with different issues and you go, oh, I did this and that really, really helped. So I've had the experience of learning about new techniques and technologies, putting them into practice and going, this isn't great. So I don't introduce anything or haven't tried anything that I haven't done myself, because now I know that it works, and I've got it on a cellular level.
That's interesting, because in my clinic in Fort Collins, most of the things we added in are because I wanted it. And I had my own things I needed help with, injuries and traumas and things like that. And so I look for things I want, and then there's other people that need that too.
Yep, exactly. So with that, so then things start getting added on, taken out, and what stays are the things that work. Because at the end of the day, when you're working with people, they want results, right? We got to deliver a result. And so that was really important to me always, to say, hey, we're exchanging energy and time, and let's be sure people get better. So with that, what I realized is chiropractic care is still a huge pillar. It's still number one with what we do. It's what everything kind of dances around. But if we're clearing your spine, we're clearing your nervous system, we're balancing your zones, but you're still eating terribly, you're still very sedentary, you're still pissed and angry all the time.
Chronic stress, yeah.
Chronic stress. We're not going to go forward as fast as we could, or we're going to get stopped somewhere. So then it became, okay, what are the main drivers that we need to address? So good spinal health, good neurological health. Then it became, all right, how do we reduce inflammation in your body? Because if let's say you have a disc and you're still eating like crap, or you're still drinking a ton, or whatever it is, that their physiology isn't supporting the health of those molecules or those cells. So we got to figure out, okay, let's bring inflammation down. So we brought in a lot of gut repair, anti-inflammatory diets, supplementation to help the actual system heal internally, metabolically.
I think the amount of people that are unaware that they have digestive issues is pretty astounding, and it's probably the vast majority of people, just because living a Western or eating a Western type diet.
Yep.
And the chronic inflammatory things. I mean, chronic inflammation is probably the thing that's tied to more just chronic systemic health problems than anything.
Absolutely.
So people come in and you're doing everything from a chiropractic standpoint, like, hey, well, I still have this and I have this. It's like, look, there's a lot going on here.
Yep.
And I guess from my viewpoint, I think one of the most important things to understand about your health, it's rarely just one thing.
Right.
That is going to make all the difference.
Yep.
You got to look at things like an ecosystem holistically.
Yep, exactly.
And you have your spine and nerves, but like gut and inflammation is like boom right there with it.
Yep. Yeah, it's huge. And then it was tacking on things like, okay, well, then let's teach people what to do at home, right? If it's like, okay, you're telling them you have to have this lifestyle, so what's that look like? So now we have an extensive home care, whether it's stretches, rehab, exercise, eating, movement, suggestions on mental, emotional processing and health, trauma processing and health. All that matters, because all of that could get in the way or be in the way. Then we started adding, then I've added Shockwave technology, and that's been a huge game changer too, to say, okay, now we can really make changes on a cellular level. We can get that tissue to change over, your body's own ability to do it.
So can you explain like how, because a lot of people hear that term, they don't always understand what shockwave therapy is. Can you explain like, how does it actually help and work with your body in healing, and especially in people as we get old that don't heal and repair from injuries like maybe you did when you were 18, 20 years old?
The main driver is the function of it is you put an acoustic wave through the tissue, and so that the easiest way to explain it is it tells your cells to start over, to start healing, and so then it goes, oh, we need some more work here. So it'll actually generate your body's own stem cells to go to the area to start to reproduce that tissue again. You'll bring new angiogenesis, new blood flow to the area. It's got a great analgesic effect, so a lot of great things. So that has really, really helped and been a great addition to kind of round out a lot of the protocols we do.
Awesome.
Yeah.
Now, one thing that maybe some of your people watching your channel or some of your patients don't know is you actually have 4 kids.
Yeah.
And the ages are from
7 down to 3.
7 to 3. So you have all this extra time in your life.
Yeah.
Right? And also your wife is a chiropractor.
Yep.
So I guess this is a 2-part question. One, how do you feel having a spouse that is a chiropractor has influenced or helps you as a chiropractor? And then what influence do you think having your own kids has made on you as a doctor and chiropractor?
Oh, that's a great question. Well, I think, from my wife being a chiropractor, it's always great to have someone that has similar ideas, similar concepts, similar beliefs, and being really solid in that. So making healthcare decisions becomes very easy for your family and for your children because you're coming from a same perspective or a similar perspective.
One of my mentors was, he was in practice 52 years, his name was Joe Stuckey, and he was really well known. He would speak on stage like Reggie Gold and Siga Foods and stuff. One thing he always said is, as a chiropractor, your spouse needs to be as much, if not more of a chiropractor than you, as far as the philosophy of chiropractic, because it's a lifestyle and how you just view health.
Yeah, exactly.
So yeah.
Yeah, that helps. She's also helped with as much as we're like, go, 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 build, serve as many people as you can, sometimes you can lose sight of the empathy piece and the relationship and grounding into what we're really doing to help people. So she helps me come back to that often and say, hey, So we'll exchange stories, and I'll tell her, this happened today, and this happened today, and this person got well. And so that's helpful to stay focused on like what it is we're actually doing here.
The bigger picture, yeah.
The bigger picture, yeah. Mm-hmm. Yep. And then what was the second part of the question?
Yeah, so I asked this because like especially in my scoliosis practice, we get a lot of kids and teenagers in, and you have empathy and you really care, but like when I had my own daughter, I always thought like, well, this is my kid.
Yeah.
And I started looking at it through her, and whether they have, especially when you have kids, they have any health problems, if you have to bring them to someone, you just want to be like confident, like you just want to make sure you're doing the best thing.
Right.
So I'm curious how having your own kids has influenced you as a chiropractor, or has it made a shift or made a difference in you as just a healer or anything?
Mm-hmm. Yeah, I would say as much as we were, passionate about healthcare, natural healthcare, sometimes you don't always do the things you're supposed to be doing. That's human nature, just like our patients. I think the biggest thing for me was to really focus on like, I need to be vital, alive, energetic, healthy, so that I can not only serve my family, but serve people better too. And it also helped me realize like people with their own families, like understanding that better at a deeper level to say, okay, if we implement some of these things, your whole family system will change. It's not just about your particular disc injury or neck issue or Hashimoto's or whatever it is.
Yep. Now, one of the things I think is, the longer you're sick, the sicker you get. The longer you're healthy, you're doing healthy things, the healthier you get. And, in our scoliosis clinic, everyone comes to us for scoliosis.
Yeah.
And unfortunately, a lot of times patients come in when their spines have already gotten really severe and it's become a crisis, or it was just kind of put off or told like, it's not really a concern at this point by other providers. And when they come in, although a lot of times we can still help them, I think, man, if we would have had you 3 years ago, or when the curve was smaller, before it was a so-called crisis, like we could have, the outcome could be so much better, right? So I'm curious for you, like where do you see that in your practice? Maybe people come in and they put things off and they come in because they're in a crisis, and although you can still help them, maybe like if we would have been working with you before it was a crisis, how could have that been different?
Well, I think that, just like you said, that's exactly it. Like the earlier you catch it, right, then the faster you can heal. There's less long-term damage. Chronic stress or stress, that's not dealt with just accumulates. So I call it like bioaccumulation, right? It stacks in your body, and it'll keep breaking down until finally your body will say, hey, something's really wrong here. So you have signs, then you have symptoms, or you have a very quiet phase of dis-ease or injury, then you have a very loud phase. So if you don't listen when it's whispering to you, then you're going to have to do something when it's yelling at you. So if we can get you when it's at the whisper phase, so to speak, people do so much better. You're going to get so much better. And I think in dealing with so many patients over the years, it's like, I haven't quite figured it out, but it's almost like it's an identity thing. People just feel like they've got to push through, they've got to go through their day. I'm just going to put that to the side. And it's avoided. And the more things you avoid, the longer you avoid things, the worse things get, right? It just kind of stacks. So sometimes it's about helping people re-identify as a healthy person. And say, what would a healthy person do? I don't eat that. I just don't. I eat this. Or, I get regular adjustments, or I go to the gym regularly, or exercise, or I have a regular spiritual practice, or whatever it is. And sometimes it's just a simple choice to change your internal dialogue about yourself and be like, oh, I identify as this, and this identity does these things. So
along those lines, even in the medical realm, people are taught at a certain age, you go in, you get this checked, you get blood work. And although they're very symptom-based, if someone went into just got regular blood work and they had high blood pressure and cholesterol, they're not just going to say do nothing, they're going to do something. But people maybe don't view that about chiropractic always. Some people do, but so you think about that, how would someone know, I feel fine, I don't have any major complaint, what, do I need chiropractic, or am I a candidate, or could it benefit me? How would someone even know that? What's the first thing?
Well, I think the first thing, an easy check is your mobility, range of motion, things you can even do yourself, like can I do a basic squat? Can I do a basic leg lift? You could look at the mirror and look at your posture. Do you have postural abnormalities? Is one shoulder higher? Is your head really forward? Are you super tilted? All those are just like little windows. And then as you get into an office, then you'd have more specific diagnostics and exams, and even x-rays can tell you a lot too.
I think the first step is just to get checked. You don't know.
Just get checked, yeah.
I hear people, like the average person would tell me, like, I don't really have any problems. Like, why would I get checked? And I think the average person doesn't really know what it's like to be functioning at a really higher optimal levels.
Yep.
Because the average person is probably just kind of drudging through life, low energy, not sleeping, and those things can be just viewed as normal, or I'm just getting older. But I think a lot of people don't know what it's like to be super healthy and functioning at an elite level.
Right. Yeah, I think you're right, and I think we're in this world, we're into it, but not a lot of. There's a large portion of the population that's like, health. It's just not a deal for them. It's not like, so it's not a value of theirs to say, oh, I got to see if I've got good alignment, or I got to see if my cholesterol is okay, or what have you. So I think that's part of it. But I always say, like, your health is fundamental to how everything else functions in your life. So like you just said, we had 5 kids. We had 4 kids in 5 years. Don't have 5 kids. How many do I have? We have 4 kids in 5 years, right? So things.
I can tell you're getting sleep at home.
Yeah, right. That's right. So you get sleep deprived, right? Yeah. You don't function at your best. So you like I talked about earlier, like it needs attention. So if you put attention into your health, it'll drastically affect all the other categories. Because everything, like a universal principle, leans towards breakdown and chaos. So you've got to put energy and attention into those categories. And health is a huge one, but you can make the argument for relationships and finances and spirituality, whatever. So what does that mean? All of it needs attention. But if you're hurt, or if you've got brain fog, or if you're sloshing through your day, you don't have energy to put into any of those things.
Yep.
So now you're doing this, and you're heading towards, what you call like entropy in those areas. So that's why I always say, like, health is such a huge pillar, because if you don't have that energy, you can't feed those other systems, and I think it's necessary if you want to have a healthy, balanced, vibrant life.
It's kind of like when you're on an airplane. They say the first thing you do is get yourself oxygen. You got to take care of yourself, and because if you can't take care of yourself, you can't help other people. And when it comes to your health, if you don't take care of your health, you're going to be limited in everything else you're responsible for doing, whether it's taking care of your kids, being a husband, working on your business. Like, as your health goes down, everything else you're responsible for suffers.
Yep.
Now, what's something that you wish, if you could give one, well, first, what's something people you think misunderstand, or a myth about chiropractic that you would like people to better understand?
Yeah. Well, I think the big one is, the obvious one is, you only go when you're in pain, right? Is it great for pain relief? Absolutely. I haven't found anything better that works better than chiropractic care.
Works too good almost.
Almost too good. But it's like, when you realize how influential your nervous system is over every function in your body, how it affects brain function, how it affects gut function, how it affects mood, energy, concentration. I mean, pain relief is amazing, and I've been in excruciating pain, and all you want is to get out of it. But there's also a whole other vast, benefits available to folks for a healthy lifestyle, as a cornerstone for a healthy lifestyle. And I think that's the biggest myth, is that you gotta be in pain or excruciating pain, or you've gotta be completely broken down to go see a chiropractor. And unfortunately, that happens, and you got to know what to do and how to take care of those folks. But what we like to do is get them to a point where they can go, oh, I'm in a place where now I can actually do this proactively, and I can do this as part of my healthy lifestyle.
Yeah, I think that chiropractic is an excellent lifestyle strategy for healthy people.
Right.
So now, you've been in practice 20 years, and obviously you learn a lot as a business owner, but also as a practitioner. If you could go back and give yourself one piece of advice as a new doc coming out of school, a new business owner, what advice would you give yourself?
Oh man, that's a good one. I would say, and just to speak from my own experience, I would say when early on, the experience was, people have to get chiropractic, they have to get what I'm doing, they have to understand it, it has to be part of their life. And if I look back at it, it was very much about me and what people thought of me, what people like, am I doing a good job, I'm doing this thing. And so I would have started with a lot less attachment to what people choose, because I can't control what people choose. And as people choose their health a certain way, I'd get so affected, or I'd get so down about it, or I couldn't help that person. So I think starting out, if you have a healthy level of, this is about them, and this is the vehicle that I use to help them, and I can do my best to explain it to you, I can do my best to demonstrate it to you, all the benefits. And ultimately, it's your body, it's your life, it's your choice. And understanding that at a better level, I think would have been healthier, and we been more successful earlier.
It's a lot less stress too.
It's a lot less stress.
And that's hard in the beginning because you're in survival mode. You're just trying to make sure, you know, there's food to eat and the lights are on in the beginning. So you get to, I think when you get to a point when you're in less stress, it's easier to step back and focus on what really matters.
Yep.
It's kind of like though your health. When you're in a crisis, you're dealing with a crisis, which is also when you're not in a crisis, that's when you can step back and evaluate how you want to approach things different, like do things like chiropractic.
Yeah, it's like your hierarchy of needs, right? You need like shelter, food, you know, those kind of things. You can only evolve or self-actualize, as they would say, if you go up in those abilities or those traits, you know.
Yep. Yeah. And if you could give just an average person one piece of advice in regards to their health in general, what would that be?
I would say you got to be the CEO of your life. And so you don't need to know how your body heals and functions at the level that you and I do. Mm-hmm. But you need to know something about it, right? You don't need to know how relationships work at the level of a professional therapist, but you need to know something about it. So a CEO doesn't know how to make the widgets, but they know how to run everything, right?
Absolutely.
So I always encourage people, just be your own experiment. Go into things in healthcare that you're interested in. Did it get a good result to you? Is it serving you? Keep it as a little micro habit. Learn something about relationship. This is a great way we communicate. This really helps our relationship. All right, that's your micro habit. You don't need to know everything at this deep level, but that's what counteracts entropy, is if you can understand what helps and you know it on at least a cursory level, then you always have inputs that keep things working and keep things moving forward.
Yep. It's kind of like, I remember one time I was talking to one of my colleagues, and we were looking at different providers we wanted to add to our practice, and I was like, maybe I'll just go learn to do this. And he said, look, if you need a lawyer, you can go to law school, or you can hire a lawyer.
That's a much better way to say it.
And I was like, yeah. So he's like, so you don't have to go, you know, you want to add regenerative medicine practice, you don't have to go learn how to do all this. Mm-hmm. You find someone that does. But the same thing for patients, like, you don't have to be a doctor or whatever, but you need to have people that have this knowledge base on your team, or your people to help you with that. And so if you don't have someone that's that's guiding you towards just being healthy, that's definitely someone you need to be on your team. Yeah. And I look at healthcare in general, I don't know anyone or any group that's positioned as well as chiropractors to be that role. I had a law firm, person that works at a law firm tell me, he goes, if you could start all over, he goes, do you think you'd go be a chiropractor, or would it be easier if you were a DO or something like that? And my response was, okay, I get, like, from a business standpoint, maybe like in a med legal, it could be easier if I was like a doctor of osteopathy. Yeah. But if I was not a chiropractor, I would not have the philosophy and viewpoint I have. Right. And that's what everything is built on.
That's right.
Cool. Yeah. So how people watching this, how do people find you? How do they learn about Shift Chiropractic? Where are you guys located? How can people learn more out? And if they're looking for someone to help them as a chiropractor, they have metabolic stuff, they have some joints, like Shockwave therapy, you do a lot of extremities, knees, elbows, that, but someone's like, hey, I just want to see if I'm a candidate for yours. Like, how does someone find you? How do they connect with you guys?
Yeah, sure. So, shiftchiropractic.com, that's the easiest thing. We're at Shift Chiropractic Denver on Instagram. I always am DMing people, answering questions, so feel free to reach out and ask questions. And then if it makes sense, we can take you through our initial process. We do initial screening to see if you are a good candidate for our protocols. And then we'll look at you holistically, right? So we're looking at brain, belly, back is the easiest way to explain it. Yeah. And because they're all so interrelated, as we just discussed, right? So if you've got migraines, brain fog, any sort of, even things like ADHD, focus issues, if you've got a chronic back, chronic joint issue, if you're having digestive issues, IBS, those sorts of things, they are all intimately related. And so what I like to call the inflammation triad, right? Mm-hmm. It's those three things get affected. And if you just address the gut, well, what about your brain and your nervous system? Mm-hmm. If you just address your spine, what about your brain and your gut? So that really rounds it out to say, okay, we're going to help this person on all of those levels that we can.
The inflammation triad. I like it.
Yep.
Cool. Well, thanks for being on the show.
Yeah, man. Thank you so much
bet.
for having me. This is great.